Thanks, Brandis. As we mentioned earlier, Illinois is setting record highs for number of coronavirus cases and hospitalization rates, with more than 6,800 now in hospitals due to COVID. According to city data, Chicago broke its record yesterday for the number of people hospitalized with COVID-19, and currently about 31% of ICU patients in the city have COVID. Meanwhile, hospitals across the state are working to maintain the ability to take patients and are delaying certain procedures amid a bed shortage. And joining us to discuss this and more is Dr. Omar Latif, CEO and president of Rush University Medical Center. Dr. Latif, thank you so much for being here. We're seeing the state set records for COVID hospitalizations seemingly every day. What is the situation currently at Rush?
Rush, like many of the hospitals in Chicago, is not currently at capacity. We have room and we have open beds. We have ICU beds and general medical beds that are certainly ample for today and for yesterday. I think where we're at, and the real answer to the question is, we're very worried about where we'll be at in 1, 2, and 3 weeks from now. When those numbers and the models continue to increase, then we'll have that even greater surge that we'll have to deal with and figure out where to take patients.
And how is Rush preparing for that?
Yeah, so it's really fairly straightforward. In any kind of pandemic, there's 3 limitations in your ability to care for people. Supplies, do you have the right amount of PPE? Do you have the right amount of IV fluids and medications? Those are your supplies. Staffing, do you have people that can staff, and beds, physical beds? In the first wave of the pandemic, as a nation, we increased our supplies and we increased our number of beds. That was the initial fear during the first surge. So we dramatically increased that number. During this surge, we realized that staffing is our greatest crisis that we're dealing with across the entire country, the state of Illinois, and the city. So specifically what Rush has done was we increased our available beds. We have a plan that allows us to flex up and flex down based on what the needs are for the community and the broader community, actually going outside of the Chicagoland area, figuring out how we can help. And we're bringing in as much staff as we can find, both our current staff, and we're repurposing staff from other areas to help create more staff beds for COVID, like all the hospitals in the city.
And part of what you're seeing from other hospitals is the delay or postponement of elective procedures or treatments for other illnesses. Are you seeing that at Rush right now?
Yeah, we are. And I think this is a complicated issue because there are people that have been in pain and been waiting and see a cure for their severe back pain or elective surgery, that phrase, it's being sort of thrown around all over the place. It's a really, really broad spectrum. And there's surgeries that are important to get done, like a mastectomy, a cancer resection from a woman that's critically important for them versus, say, an eyelid resection. Rush, just like all the other hospitals in the city, prioritizes the cases we do based on the volumes and the needs for our city. We will absolutely postpone whatever there needs to be postponed to continue to take care of the sickest patients we can take care of.
So for a cancer patient, for instance, that needs some kind of surgery or treatment, who might be worried that they might be postponed, your message to them?
Our message is we learned from the first wave of the pandemic. Hospitals like Rush, hospitals all over the country, effectively became COVID hospitals. And people were scared. We had one patient who waited 5 days with chest pain prior to coming into the hospital because she was scared. What we learned during the pandemic was the health of our community after the pandemic was worse than it was before. Delaying the appropriate care is never the right thing. So we urge all our patients to work with their primary care physicians and their consulting doctors to make sure if there's something they're putting off, that it's okay to put off. And so critical surgeries, cancer surgeries, of course, those are surgeries we still want to do. We have to do those. Part of the new normal that exists in America is living in a hospital with COVID patients and with non-COVID patients. We have a responsibility to treat all of those, just like all the hospitals.
And with the advancement of vaccines, Doctor, there's also been an advancement in therapeutics for COVID-19. Tell us about how far your hospital and others have come in terms of treating the patients that do come in.
2 years ago, the disease didn't exist. There was sparse data coming from China, sparse data coming from Italy, sparse data coming from Seattle, sparse data coming from New York. It took us a while to coordinate and collect that data and figure out what worked and what didn't work. In healthcare, we learn from best practices. we look and say these 600 patients were treated on this ventilator, on this setting, and this is what happened. That actually takes time to accumulate. It is 2 years later. We are one of the most advanced nations in healthcare in this world and have shared data in an open source way to learn best practices. Our outcomes have gotten better each month since the pandemic started. Mortality has continued to drop since the pandemic started because we learned how to handle the acute patients and the super acute patients in a way that really prolongs their life and in a way that minimizes mortality.
And one of the things that could prevent folks from coming to the hospital is getting tested, although there's been a nationwide shortage of testing. What do you say to folks that are looking for a reliable test right now?
Yeah, so I would really urge people to go to the IDPH, the Illinois Department of Public Health website, and really make sure that the test that you're getting is a verified or regular or a studied test. I think right now, like any other time where there's a huge need and a fervor, you tend to see some tests that aren't as good as others. What I would tell you is any reputable testing site, any state testing site, any healthcare facility, over-the-counter tests that have been validated, that have FDA approval on them, are very accurate tests and can be very, very helpful in guiding behavior. So we are not we very much encourage people, if you're symptomatic, to get tested. That really can pull you out of the general population and decrease the spread. So testing has always been a challenge. It has always been a challenge. And every time we have the surge, we find ourselves chasing more tests. And we're in that situation now where I'm sure many of your viewers keep going to different pharmacies and are frustrated because they see online where they have them, and by the time they get there, they're sold out.
All right, Dr. Lateef, a lot for residents and a lot for you to manage at your hospital. We thank you very much for joining us.
Thank you.